Imagine a world where you never have to sit in a crowded waiting room again, where your doctor checks your vital signs in real time from your home, and where smart technology can predict when you might get sick before you even feel symptoms. That's not science fiction. That's the future of telehealth. In today's video, we'll explore what's coming next for virtual care, the biggest trends to watch, and what this means for patients and providers alike. Telehealth exploded during the pandemic, and millions of people had their very first virtual doctor's visit. Right now, telehealth is great for routine follow-ups, urgent care, mental health, and chronic disease management, but it still faces challenges. Different platforms don't always talk to each other, not every patient has access to high-speed internet, and doctors still struggle with reimbursement and regulatory differences. So what's next? Wearables, home sensors, and medical-grade monitors will track heart rate, glucose, blood pressure, oxygen, and more all from home. This means your doctor can catch problems earlier and reduce costly hospital visits. AI will act like a digital co-pilot, analyzing medical images, flagging warning signs, and even triaging patients before they see a doctor. Imagine uploading a photo of a rash, and the system instantly tells you if it needs urgent attention or just over-the-counter care. Telehealth won't replace in-person care, but the future is hybrid. Think of it this way: your first visit may be online, your tests may be scheduled through an app, and only complex cases move to in-person care. Instead of juggling different apps, hospitals and clinics will unify telehealth with electronic health records, labs, and billing. This integration will make care seamless, efficient, and less frustrating. Policies are catching up. Some U.S. telehealth rules that began during the pandemic expire in 2025. Expect governments and insurers to permanently expand reimbursement and cross-state licensing, a huge win for access. The future must address the digital divide. Not every community has internet, devices, or tech skills. Telehealth success depends on making it inclusive, affordable, and accessible for everyone. We'll see growth in Tele-Psychiatry, Tele-Dermatology, Tele-Cardiology, and even electronic consultations between doctors. This allows patients in small towns to access world-class specialists without traveling. With more health data flowing online, protecting privacy is critical. Patients will demand stronger data security, high-pay compliance, and transparency about how their data is used. For example, a patient with heart disease can wear a smart ECG patch at home. Their cardiologist receives real-time alerts if an irregular heartbeat is detected, allowing for immediate intervention and reducing hospital admissions. Or imagine a parent uploading a photo of their child's rash to a telehealth app. AI analyzes the image, suggests possible diagnoses, and flags urgent cases for immediate review by a dermatologist. People with diabetes can use connected glucose monitors that automatically send readings to their healthcare team. If blood sugar levels are out of range, the system can prompt a video check-in or adjust medication remotely. Tele-Psychiatry allows patients in rural areas to connect with mental health professionals via secure video calls, breaking down barriers of distance and stigma. For example, a patient with heart disease can wear a smart ECG patch at home. Their cardiologist receives real-time alerts if an irregular heartbeat is detected, allowing for immediate intervention and reducing hospital admissions. Or imagine a parent uploading a photo of their child's rash to a telehealth app. AI analyzes the image, suggests possible diagnoses, and flags urgent cases for immediate review by a dermatologist. People with diabetes can use connected glucose monitors that automatically send readings to their healthcare team. If blood sugar levels are out of range, the system can prompt a video check-in or adjust medication remotely. Tele-Psychiatry allows patients in rural areas to connect with mental health professionals via secure video calls, breaking down barriers of distance and stigma. Of course, telehealth isn't a magic cure-all. The question is not if telehealth will grow, but how well we address these challenges. One major challenge is the digital divide. Not all patients have reliable internet, devices, or the skills to use telehealth platforms. This can leave vulnerable populations behind. Privacy and data security are also concerns. Patients worry about who can access their health information and how it is protected in virtual care environments. Finally, some worry that telehealth can make it harder to build strong patient-provider relationships, and that regulations and reimbursement policies are still catching up with technology. As a patient, expect more options to manage your health from home. Ask your providers about telehealth coverage and make sure your personal data is protected. As a doctor or administrator, invest in integrated platforms, training, and workflows that support hybrid care. Here are a few ways patients can get the most from telehealth. Prepare your questions in advance, test your device and internet connection, and find a quiet, private space for your appointment. For providers, success in hybrid care means learning new digital skills, staying updated on telehealth regulations, and building strong virtual communication with patients. Both patients and providers should stay open to new technologies, from remote monitoring devices to secure messaging apps, to make the most of virtual care as it evolves. For example, as a patient, you can use a home blood pressure monitor and share your readings instantly with your doctor through a secure app. This helps your care team spot trends and adjust your treatment without an in-person visit. Before your telehealth appointment, make a list of your symptoms and questions and keep your medications nearby. This ensures you get the most out of your virtual visit. For providers, digital prescriptions and integrated telehealth platforms can streamline workflow. For example, after a virtual visit, you can send prescriptions directly to the patient's pharmacy and update their electronic health record in real time. One practical way to overcome telemedicine barriers is to offer community digital literacy programs. These can teach patients how to use telehealth platforms, apps, and devices, making virtual care more accessible to everyone. Expanding broadband internet and providing affordable devices in underserved areas is essential. Partnerships between healthcare providers, governments, and tech companies can help bridge the digital divide. Telemedicine platforms should be multilingual and accessible for people with disabilities. This includes offering language options, closed captions, and easy-to-navigate interfaces. Healthcare providers can enhance telemedicine by investing in training and integrating virtual care into their daily workflow. This ensures smooth, high-quality care for patients. Finally, building trust is key. Providers should clearly explain privacy protections and how patient data is secured, helping patients feel confident using telemedicine services. Telehealth is no longer just an alternative, it's becoming the backbone of modern healthcare. The next decade will decide, will it make care more accessible, more affordable, and more human-centered? Or will we let technology deepen divides? What excites you most or worries you about the future of telehealth? Drop your thoughts in the comments and don't forget to subscribe for more insights on the future of healthcare and technology. Thanks for watching and stay healthy.